So at Monday at ASCO, I gave a talk on non-clear cell kidney cancer. The talk really reflected the complex nature of the disease. Non-clear cell kidney cancer is about 10 to 15% of cases and includes a number of different histologic subtypes. Papillary kidney cancer is probably the most common amongst those, and I've led several trials in my career in that space. The perhaps most important of those studies is called PAPMET, which seems to sort of establish Cabozantinib as a relative standard in that setting, although to be fair, for papillary kidney cancer, no real standard exists. We also explored in my talk combinations of targeted therapy with immunotherapy, and we reflected on some of the rationale for randomized studies that are ongoing right now, some phase 3 in fact, that are looking at combinations of TKI with immunotherapy versus TKI alone. And I think those trials are going to be really important, finally setting a standard for the disease. We also talked about some of the more exquisitely rare subtypes of kidney cancer, collecting duct, renal medullary, and for instance, chromophobe, and we discussed some of the emerging data for those particular regimens. Finally, we really reflected on discussions with patient advocates that we've had, and these are really critical discussions because they give us a bridge between patients and clinical trials. Patient advocates serve a really critical role in non-clear cell kidney cancer, and much of my talk hinged on how we can utilize the patient advocate to really link patients to research studies.